Alright, guys, so welcome to another episode of Hanging with Dr. Tayer. Today I have with me Dr. Masud Billah, smiling face.
Yes.
And we're just gonna discuss, have a regular conversation about medical school, his college experience. He's an international medical graduate, so it's, a lot of knowledge here for you to gain about his experiences from a different country, going through the examination, going through medical school back home, and applying, and visas and all that good stuff. Okay, so we're just gonna get into it. So first question I'm gonna ask is just for him to talk a little bit about himself and his upbringing, and we'll go from there. Okay.
Yeah.
All right.
Yeah. So before I started, he's my favorite colleagues.
Oh.
Dr. Teo is the one of the best intern
Wow.
that we have here.
Much praise.
Yeah. So as he told, my name is Dr. Masud Billah. I am from Bangladesh and I graduated from back home and came in US in 2014
Oh.
and
Okay.
completed USMLE steps and now doing the residency here at New Mac, the beautiful New Mac. We
Yeah.
can say that. So I'm the second year internal medicine resident here.
Okay. All right, guys. So you guys have heard it from the mouth of the man himself. It runs New Make here in New York, and we're just gonna go into some more questions about medical school specifically, and so you did medical school back home. Like, could you
Yes,
tell the people
correct.
where you did your medical school, and what led you to pursuing a medical career back home?
Yeah, so let me give you a little bit about the education system in
Okay.
Bangladesh. So 1 to 10th grade we call is school.
Mm-hmm.
So 11, 12 we call is like junior college.
Okay.
So that time after that you apply for the medical college.
Okay.
So after the 12th grade.
Mm.
And so there are two types of medical college back home. One is public, another one is private.
Okay.
So the public one is very competitive.
Okay.
I was lucky enough to got selected in the public one. It's called Sylhet USMLE Medical College.
Okay.
It's not well known here at USA, but it's very known
Right.
college in back home.
Okay.
So medical college is like 5 years
5 years.
and 1
Okay.
year of mandatory internship. During
Okay.
that time, you do rotating with the medicine, surgery, and OBGYN,
Okay.
like the transition year.
Transitional year, right?
yeah.
Okay.
So after that, you are free to practice like as a general practitioner,
Okay.
But a lot of people they try to do like post graduation, like
Mhm.
MD and other post graduation degrees.
Okay.
Yeah.
Okay. So would you say when it comes to applying to medical school back there, here in the US, you have to take the MCAT. Is that the same? Do you guys have a exam that you take to get into medical
Yeah,
school?
so exactly. So it's not like MCAT. So
Uh-huh.
as I told you, like after 12th grade, you apply for the medical college. So there is an admission, exam that time.
Oh,
And,
okay.
so during the college period, so
Mhm.
if you try to apply for the medical college, you
Okay.
need to study like biology, physics, chemistry, and
Mhm.
other stuff. And you make your mind that you're gonna apply for the medical college, right?
Okay.
And then there is the admission test, and as I told you, like public versus private.
Oh, okay.
So the government gonna select you
Mhm.
that hey, the score is high, so he's going to this college, that college.
Right. Oh, okay. Okay, so it's almost like there's an admission test. I'm gonna say the admission test is equivalent to taking an MCAT year.
Exactly.
In the US. Okay. How would you talk about your experience
Mhm.
going to medical school back home? And when I say experience, talking about the classes you have to take, and talking about the quality of the education.
Mhm.
Um,
Okay. So the thing is, the medical college, as I told you, is
Mhm.
like 5 years. So we divided the 5 years is at that period that I graduated, it was total 3 professional exams.
okay.
So in first professional exam we had the anatomy,
Mm-hmm.
physiology, biochemistry,
right.
and the second prop
Mhm.
we had micro, patho, pharma, and community medicine, forensic medicine, and the final one you have surgery medicine and OBGYN with the subdivisions, ophthalmology, ENT, and other stuff.
Right. Oh, okay. So it's almost kind of equivalent to just medical school here.
Yeah.
In the first semester you're doing anatomy, and then as you progress, you go to the more tough classes like pathology, micro and physiology,
Pharmacology,
like you said.
exactly.
Because a lot of people, like, the reason why I'm asking is that a lot of
Mm.
people don't, think about like going to medical school in a different country, and they don't think the level of knowledge and the level of class is the same thing, right? So that's why it's important that you're actually saying that the classes that you guys take is like the same classes that you would take if you're going to a medical school here in the US.
Yeah, even the subjects are the same. You need the subject, right? The microbiology,
Right.
pathology, pharmacology, and the topics are more or less the same,
Right.
The way of study is different maybe,
Mm-hmm.
but the concept of the topics in the study are the same.
Okay.
Yeah.
Okay. So now the other thing is the other question I have is so after you finish medical school and then you're preparing for application, and obviously now you're in the US at Newmark, how would you say talk about your experience from finishing medical school back in Bangladesh and then coming here to the US, taking the step 1, step 2, step 3 examinations. So just talk about your experience for during that time frame.
Sure. So when I was a third year medical student back home, and I was thinking about like how can I get more standard training.
Right.
Not only back home, we had the standard training back home, but like internationally
Right.
recognized, like USA training, UK, Australia.
Mm-hmm.
So I was thinking, back mine. And one of my cousin, he live here, and he told me that this is easy to come here, and if you are a doctor, if you do the USMLE,
Mm-hmm.
then I have gone through the USMLE steps and everything, and I found it interesting. It was really easy to come here if you are willing to.
Okay.
So there are two ways that time you can come here. One is like family migration, right?
Okay.
And another one is that time we had like diversity visa. That means you just apply randomly. Hey, I want to go to USA, not as only a doctor, but as in like a diversity visa applicant.
Oh, okay.
And I applied that time. It was free. I was walking in the street, and me and my friend, and they're saying, hey, there is a diversity visa is going on. Let's apply this one. I said, okay, let's do it. And I applied it, and like 1 month or maybe 3 months later, and I got a letter that hey, you got selected to go to US. I said, oh my God, what's going on? I was so happy because that time I set my mind that yes, now I'll do the USMLE.
Right.
Because anyway, I was thinking to do like international degrees. If it was not possible in USA, I would go to like UK or Australia.
Right.
So I was lucky enough to get the visa, and I got the green card.
Right.
So after completion, I came in 2014, and
Okay.
I started. So one thing I wanna share, like
Okay.
if you're thinking to do the USMLE, and you have to start as early as possible when you are in the medical school,
Right.
or
Right.
medical
Right.
college. And I made the mistake maybe because I was thinking I got the USA visa, I will go there, then I will start studying. It was not a good idea, I believe. So anyone like IMG students, if you wanna do the USMLE, do it when you are medical college student. That was the perfect time.
Okay. So I mean, I think it actually speaks a lot because waiting till like the end to like take any like medical examination, just because then you're just rushing it and you might not get the score that you would actually want, right?
Exactly. Yes.
Okay. And I know you're talking about these two visas, right? There's a diversity, and there's a migration. And
Yeah.
what is the main difference between these visas?
Okay, so diversity visa is kind of lottery,
Okay.
The USA was, giving the developing countries some, opportunity that, with the visa, if you got selected, you can come and
Right.
pursue your dream.
Right.
Another one is like family migration that I told you is like if your family live here and if they apply, it takes long time, It takes like 10 to 15 years, I think. And this is long time to get those kind of visa.
Okay.
Another one is like student visa, So student visa is kind of like I would say if you are thinking to do the USMLE, student visa is the only option for now because we don't have the diversity visa.
Oh, so no more
They closed
diversity.
it, yeah.
Oh, okay.
Maybe in 2010, after I got the visa, it closed.
Wow, that's lucky.
That's why I was the lucky one maybe. But a lot of people, after doing the graduation, they are coming here because they wanted to the USMLE very badly,
Mm.
and they are coming with the student visa.
All right.
So another thing, if you already graduated, you are no longer any student, so you
Right.
cannot apply for the visiting student here, like
Oh, really?
yeah, that is another very important section I wanna discuss a little bit. So if you are like medical student, you can apply for visiting student here at USA in different
Okay.
hospitals, different medical college,
Mm-hmm.
and they will charge the tuition fee only. And a lot of the hospital or the medical college, they don't charge at all if you qualify. But this is very hard to get.
Right, right,
Yeah.
right. Okay. So yeah, unfortunately, there is no more student. I mean, diversity
Diversity
visa,
visa.
but the family migration visa is still something.
Yes, it's still there.
It's still there. But I have the family migration visa, like it's saying, takes like a longer years, like
Correct.
5 to 10 years.
Yeah, it depends, who is applying. Yes.
Okay. And so how, like, for the student visa, like, is there anything that will put you in a good position to get those visas, like the student ones?
Okay, student one, the way it works, I know that if you do the USMLE step 1 and step 2 CK, we have, the
Right.
center for the USMLE step 1 and step 2 CK in back home Bangladesh.
Mm-hmm.
And after you completing the step 1
Mhm.
and 2 CK, you can apply for the, CS.
Mm.
I completed the step 1, I completed the step 2 CK, now I am going to do the, clinical skill.
Right.
The clinical skill you cannot do back home, right? You only can
Because
do
you have to, right? That's
yeah,
true.
in US only, even 5 or 6 centers in US,
Right.
right? So that time they're gonna see, how is your score, how is your status, and everything. Then they're gonna give you the permission to come here and do the clinical skill. And at the meantime, you can apply for your residency.
Oh, I see, I see. So you take step 1, you take step 2, and then you put in the application, and based on everything, examination status and some other information, and then they will give you permission to take step 2 CS,
Correct.
and that would be your opportunity to.
Yes. So this is a long journey.
Yeah.
Long journey, tough journey. But as I told you, even back home, if you do the post graduation training, this is 5 to 10 years.
Right.
And is also expensive. And I mean, if you are determined, USMLE is the best.
Right. Right.
The good thing about USMLE is, like, in my case, I did all the steps. At the meantime, I worked with the doctor office and nursing home
Right.
and hospitals, lot
Right.
of things. So you can expose yourself with the, American medical system.
Right. Right.
And when you apply for the, residency, they will say, hey, this, candidate is working in a nursing home or with the doctors, and he knows our system very well.
Right.
So
Right.
it will look you like very, very, strong candidate for
Right.
that position.
Ah, I see, I see. So it's not just taking the exams, it's also like, like doing something medical. I mean, especially if you want to be a doctor, right? Doing something medical that kind of like proves that you really, really want to do this.
100% correct. Yeah. So
Yeah.
that is the main point. The US doctor, the whoever is hiring you for the residency, they don't know that your medical background, your
Right.
country's practice system.
Mhm.
So they wanna know, do you know their system, like the USA system? More or less same, but the only difference I see that back home is like clinical based medicine,
Right.
right? But here is evidence based, right?
That's correct.
So that is like, so one of my dream was like, I want to combine both of them,
Combine.
like clinical and the evidence.
Right, right,
So
right.
it will make you more, I would say, the patient centric. Patient will be more satisfied
Right.
clinically, and evidence based medicine is good. Yeah.
Right. I think that's actually very key. I mean, not in medicine, there's a lot of like back in the days, like there wasn't like that much like like CT scan or MRI and stuff like that.
Correct. Yeah.
So you have to like think like a lot more clinical, based on symptoms. But now like it feels like medicine's kind of like moving to away from symptoms based like clinical diagnosis. I mean, it kind of in a sense, I will make a case for the doctors because again, you want to like with all the lawsuits and stuff now, it's also kind of like a little tricky, right? Because you want to like protect yourself.
Yeah, so that's how the evidence-based medicine came, I believe.
Uh-huh.
But also for the patient care, because if you don't have any evidence of like as for example, if you don't have an evidence of infection, you cannot give antibiotic.
That's correct.
This is very important. So I like evidence-based medicine.
Yeah.
Yeah, it's not only like the lawsuit and everything,
Right.
obviously all those things, but patient will know what's going on with their body.
That's true.
Clinically, you are a doctor, you know a lot of things, and you examine the patient, maybe this is the diagnosis, or
Right.
maybe that is the diagnosis. But
Exactly.
at that point the patient think, oh my god, what's going on, I have this one or that one.
Right.
So
right.
that time you need to do some
Some more like testing
yes,
and
yeah.
stuff like
So
that.
that's why the combination of both of the evidence and clinical based is great.
Right. Okay. So you guys are hearing it from the man himself, man. All right. So, but let's just keep going, right? So like this is like a journey, right? So we're just trying to like take you guys through this story from like college. We talked about medical school. We talked about the applications and the visas. Now we're gonna transition into now that you came here in 2014.
2014.
How would you explain your experience trying to get into a residency program here in the U.S.? Especially because we know, it's tough to say, but the truth is that a lot of the schools in the U.S. are frowned against IMGs. But how would you describe your experience when you came here in 2014?
Okay, so the nice question. So when I came in 2014, the reason I came for the USMLE, right?
Mhm.
But I had the green card.
Right.
I was lucky that I got the green card. So it was a positive point for me
Mhm.
to say that, hey, I am US resident.
That's correct.
One thing. Number two, the score are more important. Most important for the IMG.
Right.
Because you have to compete with the American grads.
That's correct. That's correct.
I believe all are smart. IMG, they are smart.
Mhm.
AMG, they are smart. But we are from the different country. But we have to prove that.
Exactly.
I have good score. I have good experience. And so what I did, in addition with the USMLE steps, I start working in doctor office to know little bit about what's going on with their medical system.
Right.
Then I worked with a doctor. His name is Dr. Mohammed Hussain,
Okay.
and he's from my same medical college that I graduated.
Oh, nice.
Yeah. So he came in 2001, I believe. Nice guy. So he helped me a lot. How the medical system worked in USA.
Okay.
Because he's the experienced one. And after that, I also worked in a nursing home.
Oh, okay.
So the thing is, if you are CFMG certified after USMLE step 1 and 2, and you have the green card, you can apply in different nursing home in New York.
Okay.
And as a house physician, we call it. And you apply Department of Health. That I completed the steps. Now I want more inpatient experience.
Right.
And if you talk with the attending in the nursing home, if they hire you as a house physician, that is the great option you have. So I got the limited permit, and
Okay.
I got the DEA and NPI number, and I worked in a nursing home for 1 year. Like inpatient, I had a lot of patient. I see all the patient in the morning. I wrote progress note that what we write right now.
Right.
Residency. So I was like kind of gone through all the medical practice and the system in the USA, and the EMR, most important things.
Right.
And
right.
those made my resume, I believe, more stronger than others.
So I think I feel like the story actually is this is a very very like great story, because not only like not only like the scores, right, like especially coming from a different country, trying to adjust here, right, like then you also have to prove that you can use the system here in the US, right? And I feel like going out there and like just getting those extra going through those extra steps of applying to these nursing homes, working under physicians, the US physicians here, I think it's very very good, because not only can they give you like letters of recommendation, but they have friends, they have colleagues, they can recommend you too, right? And then also like doing the job at the nursing home, that plays a big role, because it means you kind of understand the US clinical and medical system, right? So for those like applying, I think these are like great points. Like if you're coming from a different country, it's good to like not just like sit and wait, but in the
No,
meantime, like when you're applying, like try to like do something medical.
medical.
Right.
Another thing I wanna add here is, so you will have a lot of struggle as an IMG,
Mm.
100%. But the good thing is, if you are smart enough, I would say like that, you will find out how you can overcome all those struggle. How
Right.
you can overcome all those, the negative things that IMG had. Like,
Mm.
we don't have a lot of clinical experience. I don't know what you did in back home. You have to
Mm.
prove what I did here in
Right.
USA.
Right.
So not only like the primary care and the nursing home, I also worked in a hospital as a research assistant,
Okay.
and I published a few cases that
Nice.
time.
Nice.
So that is another thing you guys can do. You do not need like green card or anything for that. You just apply for research assistant, and there are a lot of professors. They have a lot of connections with the known face,
Mm-hmm.
and they will help you in publishing a lot of cases if you have. Those are the very very good thing for your resume and to get in residency.
I mean, this is like fantastic points, because even though you can't get into like a job like nursing or like e-date, like you can do research, and it just shows again that you're publishing like a lot of papers here in the US,
Yes,
right?
yeah.
So it shows that and usually like when you publish, your name is usually on there. There's also like usually another like attending physician, like head doctor on the paper also, right? So like it speaks a lot, because somebody can look at the paper and
Yes.
recognize the name of the other physician and be like, oh, I know this guy,
Yes.
and that just pretty much seals the deal, because they can say is vouch. This guy is vouch for
You
you.
made a good point.
Yeah.
The same thing happened with me during my interviews,
Okay.
residency interviews, in one of the hospital in New York, and they said, hey, we see that you have in publications, endocrine publication
Right.
on the topics. I know this guy. He's
Yeah.
the chairman of endocrine
Oh, wow.
society. I see. Yes, he's the chairman of the endocrine. Then they was like very happy. They was talking about that guy. So this is very good thing, as he mentioned.
Yeah, it's a good point. It's a good point. The thing with like applications, like you just never know like what is on your resume that would attract the program, the chairman, the program director's eye, right? It could literally be somebody that they know and they've worked with previously, and that's pretty much why they will give you a job. So any experience, no matter how small it is something and is important.
Yeah. Another point is like for the letter of recommendation.
Right.
If your IMG is very hard to get letter of recommendation sometimes. So a lot of IMG they work with primary care doctor, they get the letter of recommendation from them, but PMD letter of recommendation are not strong than letter of recommendation from hospital, right? As you know that, right?
That's true.
So that's why you have to work in different hospital,
Right.
volunteering, to observership, whatever you can do, and get the LOR from them,
Right.
as well as from the PMD.
Right. So how did you do any observership here in the US?
So I worked in different hospital, not as observership, because I was doing full-time job in the nursing home.
Oh, okay.
It was paid job and it was in-house experience.
Right.
So I was kind of, hey, I have something here.
Something. Right. Okay.
But I know lot of my friends, they did a lot of observership in Florida, California, everywhere,
Right.
wherever they get chance,
Okay.
there are a lot of opportunity out there, a lot of things you can do. Observership, volunteering, research assistant, even
Right.
job,
Right.
Yes.
Okay. And this observership, like, do you think it's something that is easy to get as an IMG?
I think nowadays we have a lot of Bangladeshi doctors here,
Okay.
from my back home, and they are helping a lot.
Right.
Because they are affiliated or they are working in hospitals, right?
I see.
So
Okay.
they try to help you.
Right.
Like, and the Indian doctors, I know they are helping a lot.
Ah,
Indian
I see,
community
I see.
as well as Bengali and Pakistani whatever.
Mm-hmm.
So if you know someone
Mm.
and if you know them, hey, I wanna do some observership or externship or
Right.
research,
Mm-hmm.
and they will know their friends, and they will help you out.
Oh,
So
okay.
this is not like impossible to get. This is very easy to get. Yes.
Oh, okay. So again, it's important to like know, like, especially in medicine, like who like is big, so you have friends, if you have colleagues, if you have your parents and know people in the US, the physicians that work in hospitals, this is a means for you to reach out to them and tell them, this is your scores, like this is what I want to pursue, like would you be willing to help? And I feel like that's key because a lot of people just wait and they don't want to ask for help. And
Asking for help is not bad thing.
Right.
In getting residency, because you are not born and brought up here, and
that's true.
lot of people don't know you. So you have to be exposing yourself. Hey, I am Masud. I have this score. I
Right.
wanna do this, and I wanna go there.
Right.
So they will know your and intention, that where you wanna what you wanna do and where you wanna go. So they're gonna help you out.
Right, right. I mean, it speaks a lot again to intent, right? And like if you really want something, like you have to push for it, and you have to go hard, right? You can't just stay home and not do anything, and then expect to just apply and like and match and stuff like that. So I guess we're just gonna go on with the questions, and now we're gonna talk about. We've been talking about like boards and examinations and stuff like that. Like during your preparation for board examinations, and did you prepare back home or did you prepare here
So
in the US?
this is the point I made. Like I made a mistake that I didn't start studying for the USMLE. Until I graduated.
Oh, I
So
see.
I came in 2014. That time I started studying about the USMLE step 1.
Okay.
But back home, yeah. So the reason I didn't do that because the internship in back home is very hard. We had like lot of patient.
Right.
We this is a public medical college and the hospital. We had all the rural patient as well as the
Right.
all kind of patients. So the patient volume was very very high, and I was kind of like, let's get some experience from here.
Right.
I was like, do the internship as hard as possible and do it like as much as possible and do work as much as possible.
Right. Right.
I was trying to learn, with the patient clinical experience,
Right.
and it helped me a lot. The internship is not mandatory for residency.
Okay.
That is another point. You do not need to do the internship, but if you do it, it will boost up your the confidence. It
Okay.
will help you a lot. Yes.
Okay. So it's almost like you kind of sacrifice a little bit of the exam for now for like just more experience. How would you say like your experience with studying for the exams? For people that are trying to like take step examinations that are IMGs, coming from a different country, trying to get used to like the like the environment here, the lifestyle here. How tough was it for you to study? I mean, I know you had the job also, right?
Yeah. So I came in 2014, as I told
Okay.
you. So that time is like kind of winter in New York,
Yeah.
and I start working with the doctor office. And on my third day, I
Mhm.
went to NYU library.
Okay.
So this is a very big library,
Right.
and we had lot of international medical grads there.
Okay.
Very big group. Bangladeshi, Indian, Pakistani, Middle East, even American.
Oh, okay.
NYU student. So I went there in third day, and I made my card, library card, and I started studying. Like very hard.
Right. Right.
So
Right.
it was my goal to do the USMLE. So I didn't had like lot of time to spend in other things. I was like job and study, and so that was the thing. So I had a lot of friends that time, and we had like group study. And if you do not want to participate in a group study, you can study alone.
Okay.
So I started with step 1 first.
Okay.
And it's better to study the textbook,
All right.
from my experience,
Okay.
then go for the UL question bank and
Okay.
the model test,
Okay.
NBME. then go for the main exam.
The main exam. Okay, so you did step one, and then you took step two after.
Yes.
Oh, okay. So, because I know some people like take it
Together.
together.
So I had few friends there. Yeah, they tried, but they said it's not a good idea.
It's not a good idea.
Okay. They said it's not a good idea.
All right. So you guys are hearing it from the man. If you trying to study,
But I'm telling only my experience.
Right.
Yeah, but.
I mean, different experience though. But if I was to approach the exam also, like the way I did was step one first, and then step two, because the materials for step one and step two are slightly different also.
Slightly, yes.
Step two is a little bit more clinical. Step one is a lot more memorization than actual clinical thinking.
Exactly.
And what materials would you say you use for step one? I know it's a long time now, and
yeah, I know. I remember, because I'm giving advice. My younger brother and sister also doing.
Oh, okay.
USMLE back home, and my wife is doing USMLE.
Oh yeah,
So
that's true.
I'm living with USMLE. The thing is, back home, I used to use a lot of textbook.
Okay.
And it helped me a lot. So when I came here, I was trying to get like, what is the easy way to finish this step one, right? And there are a lot of books. But Kaplan is the
the Kaplan,
everyone knows about that.
Yeah.
So I had the Kaplan videos and the books and Golian for the pathology,
Right, Golian.
So Golian I studied like 2 times, and it helped me a lot. Golian is like very very good book for step one, I would say that. And the first aid after that, first aid is like very important for step one.
First aid, yeah.
Very very important. So you study first aid with the U-World, what I did. So I had like online U-World and offline U-World.
Right.
So I studied online U-World with the first aid 2-3 times, then the NBME, then go for the exam.
Oh, okay. So you first aid, then U-World. Okay, and then back again, like going over. Okay, and how would you say what is your approach to questions when it comes to question banks, and doing this question banks? What would you say is your approach?
Yeah. So the thing is, all the questions are clinical, right? Most of the questions are clinical. They will give you a vignette, like the scenario.
Right.
So in back home, we are not used to all those MCQ questions.
Right.
A little bit, not that much. So initially it was a little bit hard for us to get the gist of the question. So then I started solving a lot of questions. Then I get, yes, all the questions they are asking, they will give you a vignette, and they in step one you will say, like, they will ask you some basic things. After all the things, like all the vignette and the clinical, they will give you the diagnosis, and they will ask you like the molecular levels.
I see.
So if you see, like, whenever I'm reading the questions for this step one, I know that they're gonna ask some basic things. So I was reminding myself, whatever the question is saying, the answer gonna be like some basic things. So those things help you a lot, because when you read the question, we say, hey, let's think about the diagnosis, and after 2 lines you will see the diagnosis is there. Right. So those are the tricks you have to follow during the when you solve the MCQ for the step one.
Okay. Yeah, like I said, like a lot of people have different ways, right? And this is his approach, right? And it doesn't mean that that's what you should do.
Yes.
Like taking these exams, like you have to do what is best for you. Some people are visual learners, some are like pictures, like some are just like cram everything in and then just go to the exam. Forget everything after. So
True. Yeah.
It's whatever works for you, but it's always good to get all these experiences from different people.
Correct.
And then try to see if it can help you.
Sure.
So after you took the step one and then the step two, did you take step 3 before residency?
Yes. So I completed all those steps, then I applied for the residency. Yeah.
Okay. And now we're gonna transition to residency, right? There are a lot of people want to know. So when it came to application for residency, can you talk a little bit about your just your approach when you were applying and what you think worked for you?
Yes.
And
sure.
that way other people can learn from it.
Yeah. So for the residency application, you have to have a very good and a strong resume, right? And it must include, for the IMG, I would say, the clinical experience matters.
Okay.
in addition with the score and everything, right?
Right.
And the green card, citizenship,
Mhm.
whether or not,
Mm-hmm.
but the score, letter of recommendation,
Mm.
and clinical experience,
Mm.
those are the most important thing. So I was, if you like think ahead, then you do all the clinical experience, because
Right.
if you do clinical experience after you completing the steps, it
Mm.
will take 1 more year for
Mm.
the IMG,
Right,
1 more year is
right.
a lot, lot time,
Mm-hmm.
So what I did, as I told you, then when I was doing the steps, at that time I worked with the doctor office,
Right.
and when I completed the steps,
Yeah.
before I completion, I was applying for like the house physician, nursing home,
Right.
and the research, the publication. I did all the things before I applied for the residency,
Okay.
and I had the so that time I was applying for the residency, I was doing the house physician job.
Right.
So it was my like active job that time. So when I was giving my interviews, lot of programs was asking, what is house physician? Can you explain more about that? So I will say, if you cannot do the house physician, you can do the publications, you
Okay.
can do the research, you can do the volunteering,
Okay.
observership, and you must get LOR from the hospital.
That's correct.
Those are the most important things. In addition with the the good USMLE scores.
Right.
Yes.
So it's not just like getting like the USMLE scores and like, but you also have to have all these other publications. You have to like, it's like you have to like beautify like the scores, like kind of get you in, but you have to like beautify like all the other portions of the applications, publications, like you said, like doing something clinical, when you're here, and getting like letters or recommendations from the hospital, doctors in the hospital. Not it's not that the doctors, like primary care doctors, like the letters of recommendation are strong. It's just that you're coming to work in the hospital. Like it don't really make sense that you get a letter of recommendation from a doctor that works in the hospital. What about people that get like letters of recommendation from doctors back home? What would you say or doctors say about this?
So I got one letter of recommendation from my principal, the head of the medicine. And some program they ask for it for the IMG, and some program they ask for like LOR from back home. One LOR.
Okay.
So you have to be like careful about that. You have to get the LOR from back home, and the head of the medicine department. If you are applying for the medicine,
Right.
and if you are applying for the psychiatry,
Right.
psychiatry, surgery, anesthesia, So I got LOR from my head of the medicine, and I submitted to those program was requiring for that,
Right.
But NOMEC they didn't require for the back home LOR. Yes.
Oh, okay. So it's just something to think about. They might ask you. It's just something to start working on, because sometimes like these programs and emails, it takes a long time for you to get it.
Yes.
So
you have to be like think ahead about all those things. I think a lot of IMC they knows about the things,
Right.
but you have to be very collective about those things. Yes.
Okay. Now we're just gonna go forward, and now you've applied, right? And
Yes. Now I applied.
after applications, what do you think?
Okay. So after application, the main thing is interviews, right? How many, as IMG, you need as much as interviews
As you
possible.
can, right?
And AMG, I know that they don't want lot of interviews. They want like specific interviews, right?
Right.
The program they like.
Right.
For us, we are like generalized, get interviews from wherever you want.
Right.
From New York to Alaska, wherever. So I got plenty of interviews,
Okay.
and so lot of my friends, they also got lot of interviews by communicating with the programs coordinator, program director, or other Bengali, the doctors
Right.
who were working in different hospital. Hey, I applied in your program.
Right.
If you can look up my resume and you can help me get the interview.
Mm.
And so after getting interview, then is the main preparation for the IMG. Like IMG people, they need to give like very smart and very good interviews to get
Right.
selected. That. And because we didn't graduated from here, right? So we have to compete with the American grads.
Right.
So your interviews will more talk about your experience.
Okay.
And, and your scores.
The scores.
And other things. So those are the important, stuff I would say
Right.
during the interview season. Yeah.
Okay.
But interview season is very stressful. That's
Yeah.
true. But if you get plenty of interviews, if you practice, little bit interviews with your friends and families
Mhm.
and other attending doctors, is not that hard. Yeah.
Yeah, so I think it's key, right? You said like preparation. I think preparation is key when it comes to at least the interview season, right? Because
True.
the worst thing you want to do is like have this beautiful application, but then get to the interview, but like not be able to answer a few questions.
Yeah, very
So
important. Yeah.
be prepared, right? Like, there's certain questions that always ask. So like just know those questions and be prepared to give like an answer, right,
Yes.
for those questions. So how many programs would you say to apply to?
So I would say I applied a lot.
A lot.
So
Okay.
I applied like 140
Okay.
programs.
Okay.
Because I was like, my boundaries was not only New York, but I
Okay.
was focusing mainly New York, New Jersey, Pennsylvania, Florida.
Right.
But I applied all over.
You applied all over. Okay. And so after you did this application, you went through the interviews, right,
Mhm.
and everything, right? Like how was that period between like waiting?
So the thing is, I was full-time work at that time.
Yeah.
That was the another thing. So I didn't had like lot of times to
To think.
think. Yeah. But I know a lot of my friends. They was like, even though they are getting a lot of interviews, the stress level is very high. Because you're getting interviews and you have to prepare yourself for the interviews. Lot of things. But I was working like 6 days a week, and at the night time I was practicing with my different attendings
Okay.
from back home. They are very good. We call it Bangladesh Medical Association.
Oh,
So we have a lot of doctors there. They are like after their job, the evening time they give you time how to practice interview. They had questions and everything.
Oh, nice.
It was very
nice.
good help. Yeah, so I practiced a little bit interviews, even with my wife. She is medical student, and so she had a lot of questions. She was asking me, I was giving the answers. So it helped. Everything helped. Everything
Right.
helped. Everything boost up your confidence in the interview board, and yeah, that is the thing.
Oh, okay. So like I said, like medicine, like it's all about taking the step. It's all about asking for help. There's no pride. You learn from everybody. That's the thing with medicine, and just asking like your friends, your families, and it's also I think it's also a good point because when you like do these interviews with different people, you get different ideas,
Different
right,
ideas,
from all
yes.
this, and they can tell you what you're doing wrong, what you're doing right, and then you can just take everything in and then fix
Right.
areas, right? Okay, so now like you mash, right?
Oh my god.
That's the dream of every medical student is to like mash into program, right?
Yes.
And after you like mashed like in New York, right, at Newmeek, how would you say is your experience like being treated as a doctor from a different country coming here with your other colleagues? Like how would you say your experience has been since you started?
So after match is like the dream comes true.
Right.
Right? Now you're the happiest person in the world, right? So now you got everything you wanted.
Right.
That is the thing. We talked about the struggles,
Right.
steps, journey, everything. Now you got what you wanted, right?
That's true.
I was so happy. I was wondering if I can get internal medicine. It was
Right.
my dream job and dream subject, and in medical science. Yes, so it was very, very joyful and wonderful. And so I was living in New York since 2014. So
Right.
my main target was New York.
New York, right.
Especially the Long Island based. And this hospital is the one I wanted.
Right.
Because the location, population, and the fellowship and environment, everything attracted me, and a lot of recommendations from other doctors, and
Right.
they said, yeah, you can select this one. This is the best one you can go for. Then I selected NASA University Medical Center, and I'm very happy to work here.
Yeah. I mean, the man is smiling. That tells you everything. It means he's happy here,
Yeah.
I think it's actually a important point you said. Like when you're looking at programs, like you're looking at not just like you're looking at not just going to any program, right? And you're saying like you looked at like fellowships to see they have fellowships. The environment was also key. So I think it's also key, like when you're looking at programs, like not just to like just go to anywhere. I mean, obviously you want to match, right? But I
Yeah.
mean, when you're ranking, like you want to rank based on like where you would want to be, like what state you would like to stay. Do they have a fellowship programs? Especially now with fellowships, especially like the big ones like cardiology and GI, it's a lot of like
Yes.
in-house, right?
Yes, in-house.
So that's big too, right?
Yeah, the beauty of fellowship, having fellowship in a program is like you will have lot of educational sessions,
Right.
you know, because you have fellows, you have attendings,
Mm-hmm.
you round with the fellow, then with the attending,
Right.
you have medical students here, you know.
Right.
So this is like awesome, very awesome.
Right.
So I liked it with the rounding with the fellow and then with the attending. And lot of program, you know, if they don't have fellowship, they round on with the attending, and that's all, right?
Right.
So you have like double layer round.
Double, yeah.
So, yeah, it helped you a lot. Yeah.
Alright, so like I think that's actually key because you know if it's fellows and then there's attendance, there's like different like levels, different levels to it. So I don't know if you have the answer to this question. Like a lot of your other friends, right? They try to match into maybe different specialties. Like some of the big ones, right? In dermatology, maybe surgery. Like would you say it was tough? It was tougher for them to get into those specialties.
So this is tough than
Mhm.
internal medicine, I would say,
Right.
and especially the anesthesia.
Mhm.
As you're doing,
Yeah.
best of luck.
Anesthesia gang.
Yes, gang, yeah. So this is not impossible, I would
Right.
say. This is tough but not impossible. If
Mhm.
you have good score, if you have, as I told you, I was wondering how I can get in for internal medicine.
Mm.
So it was my mission. If you had mission like that for the anesthesia or
Right.
surgery, dermatology, ophthalmology,
Mhm.
yes, you can get it, but a little bit tougher than.
Tougher, right?
Yes.
I think it's actually key, right? I mean, it's like some of the specialties are a little tougher than the other ones, right? And if you like really want it,
You can
like
get it.
you can get it. Like you said, like everything you were doing, like when you first came, it was a lot, pertaining towards iron, right? So if you are coming to the country, I would say you wanted surgery, like you would probably like shadow like a surgeon.
Yes.
You'd probably like done like surgical research, like kind of like in the same like
Same.
everything has been same, but on the surgical part of it, right? Like what would you say?
Correct. I would say the same thing.
The same
yeah.
thing.
Same thing, yes.
Okay, so like just like if you're surgical ophthalmology, like you would find an ophthalmological doctor, get research, same like family of people that that like that specialty,
Correct.
and like that would be like your approach. I mean, it's still tough, but that would help, definitely help you, bridge the gap a little bit. So now that like you I am like it's a second year. How would you say your experience has been, during residency? Would you think it's tougher than you expected?
No. So the thing is, I was thinking the residency going to be very, very tough.
Okay.
Because I came from another country
Right.
and I don't know how the residency works.
Mm-hmm.
I heard all the tough thing about residency.
Right.
This is the toughest, but it's not that much
Mm.
because as I told you, I did internship back home.
Right.
In medicine, it was very, very tough.
Mm.
It was very tough. Lot of patients, even more. I had to see like more than 50 patients in a day.
Wow.
So this is like crazy.
Wow.
But you don't need to write notes like 50 notes.
Right.
But you have to see a lot of new patients, snake bite and everything.
Wow.
Everything. Like ICU. So after doing all the things, and I also worked in a nursing home as I told you,
Right.
right? So everything helped me.
Mm.
Everything. So when I started residency at the beginning as an intern, and I was like kind of going through the EMR system and
Right.
Nasa University Medical education system and the health system, and it took a couple of months.
Mm.
Then you will know how things works.
Mm-hmm.
So I would say it's not that tough, but I mean it's not that tough. Yes.
Right. I think actually like everything what you just said actually like makes a lot of sense because after all this like being back home, all this experience, and then coming here like garnering more experience, and then also like hospitals and research and stuff. It helps for a smooth transition. I feel like that's the reason why when you come into the country, you don't just want to like sit and not do anything. right? You want to try to figure out how you can, gain a smooth transition into residency programs, because the last thing you want is starting the residency and being behind,
Yes.
because like you're not used to like the system and everything, right?
Yeah. So the another thing I want to mention. So for the IMG,
Mhm.
lot of IMG nowadays they are doing the USMLE when they are like medical students. Very good thing.
Mm-hmm.
And even they completed the step 1 and 2 CK before internship. Back
Wow.
with good score, hands-on score.
Mm-hmm.
Those are the very I would say they are progressing a lot.
Mm-hmm.
Another thing, those who are not who are doing their USMLE after the graduation, after coming here or
Right.
back home, they have to work in different hospitals.
Mm.
Otherwise, if you only study giving exams in
Mhm.
2 years or 3 years, you are not in touch with the patient.
Right.
So when you start residency, then you will feel like less confident than you are supposed to.
Right.
Very important for the IMG only.
Mhm.
But AMG, those are the American grade. They are rounding with the
Right.
different hospital. They knows how things works.
Yeah.
For the IMG, very important. Keep in touch with the doctors, patient, hospitals, and do the USMLE step as soon as possible.
Mm.
Don't waste time,
Mhm.
and just apply for the residency, and it will, as he told, the transition gonna be very smooth.
Right.
You will not feel like, hey,
You're behind.
you're behind.
Yeah. I think it's key. Yeah, getting the exam out of the way as soon as possible. Honestly, I feel like it unlocks a lot more space for you to do other things too, right? Because now that you're done with all the exams very early, you can do a lot more rotations. You can do a lot more publications. You can do a lot more stuff that can boost your application, right?
Correct, yeah.
All right. So second year now, is about to finish IM residency. Time flies, I think,
Time
when
flies,
it
yes.
comes to medicine.
Yeah, I'm thinking like I started like few months back. I think, yeah. I still remember the mass day.
Right.
Time flies. Yes.
So time flies. So what are you gonna go into? What are the things you're thinking about right now?
So my dreams was like internal medicine, as I told you. The reason was like internal medicine is very broad
Right.
nowadays. You can go anywhere you want, right? From the internal medicine, and as an internist, you are not treating only like heart or lungs or GI tract. You're treating as a whole, from head to toe, right?
Right. That's correct.
And you know what's going on with the patient, like psychiatrically, cardiac, pulmonary, GI, musculoskeletal.
Right.
You know everything about your patient. So for now, I'm not thinking about fellowship. Hospitalist plus primary care and maybe nursing home, because as I told you,
Yeah.
I worked in nursing. I loved it. I love
Right.
older people.
Okay.
And that is the thing. So practicing internal medicine is like my passion.
Right.
I love it.
Okay. So I mean that's key. Like hospitality is saying, and then like a primary care, and that's the thing with medicine. Is the beauty of like internal medicine is so many branches, like you said, too, right?
Yeah.
Cardiology, gastroenterology, pulmonology, EMONC. There's a lot of stuff you can branch into from doing that. So the other question, like I do like I have for you, is after like you finish it, like does it matter where you would like to practice, or is that something you're thinking about right now?
Practice for like
after you finish and you like have
Okay.
a degree and everything.
So I have my plan ready, right? After the degree, then I'll start job as hospitalist, I believe, and with the primary care and the nursing home.
Nursing home.
Yeah, those are the key thing I'm thinking right now.
Okay.
Yeah.
Okay. So that's good, right? I mean, the thing is that you have to like think about these things, before like second year, first year, like you still don't really know too much about like what you want to do with your life. It's like a lot of materials, a lot of like trying to get used to the system, love getting used to like, writing notes and stuff like that. And second year, like it's a lot more autonomy for sure. Like you are almost like kind of like the physician, I want to say, right?
Yeah. But thing is, from second year, I would say the most important thing I'm missing right now, I think we need to study more during the residency.
Right.
So now I start studying again with the we see a lot of patient here, right?
Mm-hmm.
So if you go home and if you study a little bit about those patients,
Mm.
it will make you more confident, more and more,
Right.
and it will help you when you practice alone.
Mm.
So now you have your attending and other, to back you up. But
Right.
after completion, you're gonna be alone.
Right.
attending. So the study is the key, point during the residency, I believe.
Right.
Yes.
Okay. Yeah, it's another key point. Like the residency is tough. Like it's a lot of discipline. I want to say, because if not, you come back home like seven sometimes, and you get back home and you don't even have any
Sometimes
energy.
you don't come back home 24 hours.
Or sometimes you're on your way home and they call you back.
Yeah,
Come back.
come back, please.
Residence is I think it's tough. It's a tough environment, but it's manageable. I want to say, and it's fun. It's also fun, right?
Nice point. If you love it,
Mm-hmm.
this is fun.
Right.
I love it. Like we fought for the residency, right,
Right.
for a long time. So now we are doing residency.
Mm-hmm.
So I love it. So if you love something, then it will not give you a hard time.
I know. I think that's the key. Like a lot of people like want to go into medicine, right? But,
Mhm.
and people say doctors are rich. We're not really gonna go too much into
No.
that
We're
conversation.
not talking about money.
But if you like going into medicine, you have to go into it for the love of it, right? And
Love, yes.
if not, if not the stress and the workload will just weighing you down. It's a very very like a fun environment, but you also have lives in your hands, right? So you have to be meticulous in everything you do, your notes and everything. You have to make sure you're documenting the right things. Physical examinations, and you're here 7 to 7 p.m. This is like a home.
Yeah,
It's
this is the home, the first home.
this is your first home.
First
and
home, yeah.
Your actual house is your second
Yeah,
home because you
but-
stay here.
Yeah, the good thing, you're treating the patient.
Mhm.
They are in pain. You're relieving their pain
Mhm.
by the help of God.
Right.
And obviously then you feel good about that.
Mhm.
Whenever you go home, you think about those patients,
Mm.
their smiley face, they came with crying, then they smile.
Mm.
Those things make me feel very good about
Mm.
myself,
Mm.
about my profession and everything.
Right.
And inner peace is important.
Yes. It's rewarding for sure. It's rewarding. Especially for like all most patients in the ICU, they come in like very, very like in a very bad state, and then you see them a couple months later, and they look like like good, and you kind of feel good about the work you.
Yeah. So this is very important for me. Even my father was a teacher.
Mm.
He told me that if you can bring smile to other people,
Mm.
this is the best thing in the world.
Exactly.
Yeah,
Exactly.
That's what we are doing.
Yeah.
We are trying to do. We are trying to do.
Yeah. I think healing, right? Healing. I mean, as a physician, I feel like a lot of healing as a physician is more than just medication you give the patient, right? It's the time you spend with the patient, the time like you spend with the family,
Yes.
you're just like smiling to them, like
True.
encouraging them and stuff like that. It goes a long way,
Yeah, even for the internist, the reason I choose internist, one of the reason that we
Mhm.
are talking about, you can talk with the patient,
Right.
not only like the disease process,
Mhm.
but also their family
Right.
issues and conflicts and everything, and a lot of things. You're treating the patient's disease as well as like his the personal life. Everything
Right.
was going on with
Right.
the patient,
Exactly.
and it will make you feel connected with the
Mhm.
patient.
Yeah.
And the patient gonna be trusting you a lot.
Right, right. I that's very, very true. A lot of times, like some patients like have like reasons why something is not like something like reasons why like, let's say they're not taking the medication. Sometimes they have like a family reason. Or
Yeah.
sometimes they recent death in the family, and if you don't know that as a physician, no matter how much you're trying to treat this patient, there's depression there somewhere.
True.
And if you don't fix that, depression, then you can't really fix what is going on with
Nothing.
the patient.
Yeah. Very good point. Yeah.
So it's key to like you treat you treating patient as a whole,
That's
not just like a percentage or like a portion of what it came in. So we've talked about a lot of stuff today, a lot of resources, and the man himself is giving you all the needs and grannies as to everything you need to do. So all you IMGs out there, this is like good information for you, especially coming from a different country. I know sometimes it can be very, very difficult, right? But the thing is that a lot of people, have come before you, and they've been able to do it. So it just tells you that it's very, very possible. With a lot of like work, a lot of like detailed in, and one of the reasons why we actually talked about making this video was because we know there's a lot of other IMGs out there, right? They are like trying to get into residency just like you are now and I am now, and the thing is like they don't have the information.
True.
They lack they're ignorant of the information that would help them, take their studying and take their knowledge to the next level. And that's one of the reasons why we came up and we made this video, to help other people that are in the same situation, IMGs from a different country, different continent that are trying to like match into a program in the US, in the UK, and the goal is that hopefully this video right helps.
Yeah, obviously, yeah. But if you guys have any question, you can contact with us.
Right.
And yes, but I talked a lot about myself. But
Right.
tell me more about yourself, right? Yeah.
What do you want to know?
I mean, what's your plan and where are you going? Yeah.
I'm
I
an
know you are a doctor, but
I'm an open book. So like my plan. I mean, first and foremost, I'm first year prelim intern, also here in New York, right? And a lot of you guys that follow me already on Instagram or Facebook or Snapchat, social media, know I matched into anesthesiology, and I know like I haven't like really talked about why, but one of the reasons why I applied anesthesia, actually plays a role to like my high school years and being a musician myself.
wow,
Yeah, so I play the piano. I'm a pianist.
wow. Great.
And when I first finished first 2 years of medical school, right? So my program is a 4-year program, 2 years basic science and then 2 years clinicals. I always wanted to do surgery, so but when I came in my third year for my surgical rotation, I didn't like it, and this was a tough time in my life. Imagine always saying like this is what you want to do, this, and then you actually come to the place to do it and you don't like it. Like like it throws you into like this thought process. You're like, what am I gonna do in my life? But then I did that 1 week in anesthesia and I loved it. And I always compare the OR to like a musical orchestra, like an opera, right? It's like you as the anesthesiologist, they need you to do everything, right? It's like you're playing the piano, you're playing like all those multiple keys,
Okay.
and you're trying to make one tune, right? And that tune is patient care and patient safety. And all those keys, like you're playing the surgeon, you're playing the techs, you're playing the instrument techs, you're playing like the nurses and everybody in there, and the goal is to like make everybody sing one tune, and that one tune is patient care and patient safety. And so it kind of like been in the OR, and I was also a chess like player. I played like chess championships in high school, and a lot of anesthesia is critical thinking with other specialties too, because you're thinking about like if this patient is on the bed, if this happens, what am I gonna do? If I give this medication and the rate or the blood pressure drops or whatever, like what am I gonna do? Like you're thinking about things that will happen during the surgery, and then you're moving pieces. It's like chess, right? You're moving like pieces and everything. You're trying to, if this happens, like you move the space, right? So it's like you're ready to like make moves. So that's the way I fell in love with it. And being in like college, after college, I was a phlebotomist too for like a couple months, and a lot of anesthesia is like a lot of like lines and stuff. So like at that point it was just, so at that point it was like nothing else, and that's the way I fell in love with anesthesia. And obviously now I marched into anesthesiology, and right now for anesthesia you have to do a prelim year, first year in medicine or surgery. So right now I'm doing my prelim year in medicine. So obviously I haven't like done anything like anesthesia yet. That will be like next year. But I'm looking forward to it. Starting like the next 3 years in anesthesia. My goal is to match into do a fellowship in pain medicine, and I have my own clinic. I have a set schedule. I love being in the hospital, but sometimes I feel like I need like my own time and my own hours.
That's nice.
And the plan is maybe on the weekends, work part time at the hospital in the OR.
Wow.
So that way I
Right.
still have that
So you will have a life and
experience,
wow,
you know.
nice, nice.
So
guys.
that's it. Any other questions?
Guys, I can tell you, he will be the greatest anesthesiologist. Yeah, he is the
You had
best
it from
one.
him.
Yeah, best one. Yeah.
I don't
That's
know,
nice.
like it's love, like I mean, with every specialty, with everything, I feel like it's the work, right? You put into it,
Yes.
and you know the hard work you put into it is what you get from it. You know, like a lot of people say, like your scores, your scores are important. Don't get me wrong, right? But you can have a great score and you come into working in a hospital. If you don't put effort, if you don't put work into it, you're not gonna be the best physician, you know, as there is. So it's a lot of like you said, like day-to-day basis, like you know, one patient at a time, right? And then and after that patient, you read up on the diagnosis, you read up on like everything, and that amount of work you put into it would help another patient
Correct.
coming in with the same situation.
Correct. Yeah.
So it's a lot of like work you put in, no matter what specialty, you know, it's the time, the effort, and the work you put into it, and those are the rewards you would reap from it, I think.
Exactly. Yeah.
Okay, guys. So, if you guys have any more questions, I'm gonna like and the link I'm gonna like put his Dr. Masud's email, so you guys can reach out to him. You guys can reach out to me. I can ask him questions if you guys have any more questions. It's always like nice, like like sharing our journey and our thoughts about like medical school and applications with you guys. So, I mean, a lot of you guys going through the same thing. I just want to encourage you, right? Like it's very, very possible, right? And if you put work into it, you definitely can achieve it, right?
Yeah. So 100%. So as it told, so everything, if you want it, you can get it. So for the IMG, especially back home, I know that after the MBBS, I mean the graduation back
Mhm.
home, a lot of people are doing the post graduation degree. It takes
Right.
5 to 10 years. Why
Mhm.
you are not giving the exact time here for the USMLE?
Right.
And you can get it obviously. I'm sure about that. It's a little bit expensive for the student visa and everything, but it's not that much, and a lot of help around there.
Mhm.
And if you want it, you can get it. We are here to help you. If you need any question,
Mhm.
let us know, and I'm very happy to give you the answers if I know anything about that. Okay.
All right, guys. Thanks for hanging with us. I know it's a long video, but it's a video that has to be done. Just like give you guys the in-depth, in-depth feeling about everything, applications from school to application season to visas to all that good stuff. Okay. So again, tune to the next episode of Hanging with Dr. Tayo. Thank you.
Yeah.
All right.